Good afternoon, everyone, and welcome to the latest installment of the Personal Wealth Strategies Speaker Series. We have a wonderful presentation for you today, and before we get started, I just want to remind everyone that these presentations will take place each month, and we do have a schedule in the process of being put together for the January through May period of time. So you watch for that email coming out shortly with that schedule. We'll also post it on our website, so you'll be able to see those dates as well. Without further ado, I'm going to turn this over to Linda Devaney, one of our team members, who's going to introduce Cindy to you. And I thank you for your attendance today.
Hello. I extend a warm welcome to everyone listening in on our Lunch and Learn session today. Today we will learn in this next 30 to 40 minutes how to manage food and fitness to prevent the onset of diabetes with our guest speaker, Cindy Primerano. With the new year approaching, we thought this would be valuable information as we close the new year and enter the new one towards better health. Cindy Primerano is a wife and mother of 3 children, James, Anna, and Alberto, all of whom are in elementary school. She graduated in 1997 from the University of Scranton with a master's degree in physical therapy. She currently works at Atrium Post Care of Hamilton. Cindy is a certified fitness instructor in BOQA, Pound, and trained by YMCA as the group facilitator for their diabetes prevention program. I truly don't know how she does it all. During a recent doctor's visit, I was told that I may have a diabetes risk factor, so I will be listening ever so closely and making changes to prevent that possible risk factor from going any higher. Now, without any further delay, I thank Cindy for being here today and educating us all, and turn the presentation over to her.
Thank you very much, Linda. And I thank you all for your attention on this very important topic that I'll be discussing with you today. Before we start, I just want to give some mention to a couple of the references that I'm going to be using for this presentation. One of them is the Prediabetes for Dummies book by Dr. Alan Rubin. And the other one that I did take reference to was my manual. As Linda had mentioned, I'm a trained facilitator for the YMCA's Diabetes Prevention Program. So I just want to give you an idea of where some of this information is coming from in case you wanted to do some follow-up. So we're going to move to our first slide where we're going to be talking about the agenda. What are we going to be looking at today during this presentation? I listed 4 bullet points there. The first one is to determine the risk factors for developing diabetes. The second is to identify the reasons why preventing diabetes is so important. And as we're going to learn today, they are not only cost reasons why, but also for your overall health. Why is it so important that we want to prevent diabetes? The third bullet point there is to discuss the non-modifiable and modifiable risks for developing diabetes. Those non-modifiable ones are the ones that we really don't have any control of. They're truly genetic. And the modifiable ones are the ones that we are going to focus on where we can impart change. And finally, we're going to discuss some tools to incorporate lifestyle changes to prevent diabetes. And this is really the take-home message that I hope that you can take home for yourselves as something you can use or something you can impart to a friend or loved one. So I'm going to make a great impression here. It's my first 5 minutes here on the mic, and I'm already going to ask you to take a test. So what I invite you to do is you will see the pre-diabetes screen here. And this is something that we use as part of our YMCA's Diabetes Prevention Program to see if participants are appropriate for the interventions we have for that program. So what I'd like you to do, you can either take note on pad and paper, or you can keep track of your numbers in your head. But we're going to go ahead and go through this list of questions, and at the end we're going to come up with a total and see if you might be at risk for developing diabetes. So the first 3 questions are yes, no. Yes is 1 and 0 is no. No is 0. Are you a woman who has had a baby weighing more than 9 pounds at birth? So you're going to answer that one. The second, again, yes is 1, no is 0. Do you have a parent with diabetes? The third question, do you have a brother or sister with diabetes? And then the final two, the yes answer is going to have 5 points, and the no is still going to be 0. The fourth question is you're going to find your height on the chart, and to the right are 2 columns, height and weight. So you're going to find your height in the one column and find the corresponding weight next to it. And the question there is, do you weigh as much or more than the weight listed for your height? A 5 is yes, and a 0 is no. And then finally, the last question on our screen, again, 5 is yes, 0 is no. Are you younger than 65 years of age and get little or no physical activity in a typical day? So you're going to do that tally in your head, those 5 questions. And at the end, a score of greater than or equal to 9 indicates that you are at risk to develop diabetes. So just keep that number in mind as we move forward through the rest of the presentation. Okay, so next slide here, I'm going to give you a little bit of background on what is diabetes, the different types of diabetes conditions that there are. And the first one is type 1, or what may be more commonly known as juvenile diabetes. And this is an autoimmune disease that usually occurs in children. And as these folks grow older, you may see them carry insulin pumps on them. They don't produce enough insulin. So that's type 1 diabetes. Gestational diabetes is the condition where women, when they are pregnant, they don't usually have a diagnosis of diabetes before their pregnancy, but during pregnancy, they do have a diagnosis of diabetes. So that is gestational diabetes. And then the third type of diabetes, which we are going to be talking about today, is type 2. And this type of diabetes occurs in both children and adults. And it's associated with risk factors like being overweight, having high blood pressure, and being sedentary. Now, the next couple of bullet points there may or may not surprise you, but studies have been done, many studies, and right now there are about 26 million Americans who have been diagnosed with diabetes. And one statistic, which was taken in 2010, said that in that year alone, 1.9 million Americans were diagnosed with diabetes. Now, being that this was 5 years ago, I'm pretty confident that that number is probably even a little bit higher than that.
Cindy, I'm sorry to interrupt
Yes,
you.
sure.
I was just informed that the slides are not showing up. Your voice is coming through, the slides are not showing up. So what we're going to do is we're going to go ahead and continue, but I'm going to post the slides up on the website afterwards next to this so that you're able to see the slides. But if you can be descriptive as you're talking.
Oh, okay.
I just don't want to throw you off.
Okay, sure. Okay. So the next slide on the Did You Know, the next bullet point on the Did You Know slide is that diabetes is a leading cause of heart disease, stroke, blindness, kidney disease, and nerve disease. And these are the types of sequelae, these medical complications that actually are what is most problematic. It's not diabetes itself, but it's the complications that follow because of a diagnosis of diabetes. Now, one thing I'll mention, it's not on the slides, but people often ask me, okay, I have diabetes. Now you're telling me that I'm going to have possibly complications of heart disease, stroke, other things that affect other systems of my body. Well, I'm just going to give you a quick Diabetes 101. What exactly is it? With a person with a normal resting metabolism, their glucose level is somewhere between 70 when they're fasting, if they haven't eaten anything, and that's milligrams per deciliter. We'll get into that in a bit. And then it can go up as high as 140 after an hour after you've eaten a meal. So that's a pretty narrow range of where your quote-unquote normal glucose level should be. So somewhere between 70 and 140. Now what happens is you have glucose that's in your body, and your body uses that glucose for energy. How does that happen? Insulin, which is a hormone produced by the pancreas, it actually helps to open up the cells of our body. So our muscle cells, our brain cells, our blood cells, insulin opens up these cells so that glucose can enter, and then the body can then use that for energy. Now, you can imagine that if there is a disconnect between the amount of insulin that's available and the amount of glucose in the body, if there's extra, quote unquote, extra glucose flowing through, then the body is going to have a tougher time metabolizing all of that. And the systems that need that energy, again, our muscles, things that we need to build up the muscles, our brain cells, our blood cells, they're all going to be struggling. So this is why, if there's a disconnect between the insulin and glucose in our systems, this is why we have the subsequent problems in our other organs of the body. So that's just a little quick did you know about diabetes. I'm going to then now go to the next slide, which is the cost of diabetes. Now what this does, this slide here is going to list some maybe scary figures, maybe not so scary figures for some, but the first bullet point here says $245 billion annually. That is how much money is spent with taking care of the health costs of diabetes and the subsequent clinical problems that come from it. Out of that $245 billion, $114 billion is spent on education alone. So really, we're trying to do a very thorough job in making sure that folks know how important this disease is and how critical it is to know how to prevent it. People with diabetes can spend between $4,000 and $12,000 annually on health costs. Now, my previous slide had said that there were 19 million people, many million people who are diagnosed with diabetes. If you multiply that by that $4,000 to $12,000 per person, you can see how that cost would be in the billions. The next bullet says most of the cost of diabetes and prediabetes are for treating the complications, and I listed 4 here. One of them is eye disease that could possibly lead to blindness. The next one is kidney disease, which could lead to kidney failure and dialysis. The third complication is nerve disease. Being a field, my background is a physical therapist, and I've seen this often where I see patients with a history of diabetes, and I do a skin inspection, and lo and behold, on the plantar aspect of their foot or between their toes, they have a wound that they did not know they had because they had impaired sensation to their distal extremities, to their feet. So that is definitely something that we see a lot, is with nerve disease. And then the fourth bullet point there, one of the complications of diabetes is heart disease, heart attacks, strokes, severe leg pain. Again, something I see in the clinic as a therapist. Someone with a history of diabetes will sometimes come to us with an amputation of a foot, and then they go home. They might not be so compliant with some of the things that physicians and therapists and nurses have recommended. They come back to us 6 weeks later, and now they're a below-knee amputation and so forth and so on, sometimes bilateral legs. So it's very serious to make sure that we are aware of how to prevent this disease. And then finally, the last point there, it doesn't have to do so much with the healthcare costs, but I have something here called the societal costs, where there's lost productivity if you are not able to come to work, if you're on disability, if there are things that you can't do because of your illness, that you are spending about $8,800 per person. Every person is spending about that much in societal costs because of diabetes. So something very serious that we have to consider. I'm moving on to the next slide here. Now, this is not all doom and gloom. I know I've painted a rather grim picture. Now you all want to say, okay, that's it, I'm done. What can I do? There's very good news, and that's what the next slide says. The good news. The good news is that lifestyle changes can prevent or delay the development of type 2 diabetes. And what does that mean? Things like eating healthier, increasing your physical activity, and losing a modest amount of weight. these are the things that we are going to be addressing for the bulk of the rest of this presentation, those lifestyle changes that we can all do to help prevent diabetes. Okay, now I'm moving on to the next slide, which is we're going to talk a little bit more about what is a pre-diabetic, because I think with diabetes, people are a little bit more sure. You go to a physician and she or he has said, okay, you have a diagnosis of diabetes. These are the medications you can take. Or on the flip side of that, you're either not a diabetic. It's pretty clear whether you are or you aren't. This pre-diabetic phase is the place where people aren't quite sure, what should I do? Am I pre-diabetic? So this slide, which I got the information from the American Diabetes Association, they have defined that a pre-diabetic is somebody whose blood glucose levels are higher than normal, but not enough to be called diabetes. And what I've done here is I've listed the 3 different types of glucose levels. Now, by no means are you expected to memorize any of these, but this is just kind of a guide so that when you go to your physician and then he or she takes blood work and you get that back in the mail, you might be able to say, ooh, my impaired fasting glucose is 105. Is that pre-diabetic or not? So I'm just going to go through some of these quickly. The first is the impaired fasting glucose, or the IFG, and that is the level that your physician looks at. You will be asked to fast, don't eat past midnight. You go in to the lab the next day, and hopefully they don't see you very late in the afternoon because you're probably starving by then. And then your blood glucose level comes back between 100 and 125 milligrams per deciliter, 100 to 125. Now, anything less than 100, the literature is saying that's a normal, quote-unquote, normal blood level. Anything over 125 is considered full-blown diabetes. So that between 100 and 125, impaired fasting glucose, you're considered pre-diabetic. Okay, the second one there, the impaired glucose tolerance, the IGT, that pre-diabetic range is between 140 and 200 milligrams per deciliter. So 140 to 200. This is a number where I know myself, my grandmother, she will check her blood sugar and she'll say, oh, Cindy, my sugar is 150. Is that good? That could be good for her. For some, 140 is normal. I mean, it all depends on what your baseline is. But generally speaking, after you've eaten a meal, if it's more than 140 to 200, that could be cause for concern. You could be pre-diabetic with that range. Of course, all of these numbers, the best thing to do is to talk to your physician and see what he or she says. And then the third bullet point there, or the third type of glucose level, is the glycated hemoglobin, or the A1C, which measures the average blood sugars over the past 3 months. And that percentage where it's considered a pre-diabetic range is between 5.7 and 6.4%. So again, 3 types of blood glucose levels. Your doctor will determine which one is most appropriate for you, and then you can kind of compare and see. So you have this information in addition to the screen that you took, and you have a better idea whether you're pre-diabetic or not. Okay, and I just put a little bullet point at the bottom there that there are no clear symptoms for pre-diabetics, so you may not know that you have it. So that's just another reason why you want to have a close relationship with your physician to see if you do or don't. Next slide here, we talk about the correlation between obesity and diabetes. What is obesity? Obesity is a BMI, or a body mass index, of greater than or equal to 30, or approximately 30 pounds overweight. Now, you can find your BMI if you do an internet search. You can find out how to calculate it. You plug in your height, you plug in your weight, and then it gives out a number. The normal range that the National Heart, Lung, and Blood Institute gives us, a normal range for BMI is between 18.5 and 24.9. Overweight is between 25 and 29.9, and to be considered obese, it's greater than or equal to 30. So there has been a correlation that if you have a BMI of greater than 30, there is a risk that you could develop diabetes. Okay, next slide. We had talked about on the agenda earlier, what are the risk factors associated with diabetes? There are some that are non-modifiable and some that are modifiable. The non-modifiable, the literature really looks at 3: age, history of diabetes, and race or ethnicity. So by age, really there was nothing that said by this age you were more susceptible to diabetes. It was kind of a general thing. The older we get, we're more at risk for developing diabetes. So I guess you could safely say if you're 85, you're more at risk for diabetes if you were 65. Another thing that was kind of interesting about age, though, and actually a little bit scary, is that in 2007, the CDC, which is the Centers for Disease Control, they reported that there were 2 million children and adolescents who had prediabetes, and that was in 2007. So it seems that the younger we actually are developing prediabetes sooner. So that's age. Second is history of diabetes. We looked at that in the risk assessment, whether your brother or sister has a history, whether your parents have a history of diabetes. There is a genetic predisposition to diabetes if it does run in your family. And the third one that's non-modifiable is your race or ethnicity. There were several studies that were done. Take-home message there is that there are some ethnicities that are at higher risk for developing diabetes. So that's just something, again, it's non-modifiable. Non-Hispanic whites, non-Hispanic blacks, and Mexican Americans are a little bit more prone to having prediabetes than other types of ethnicities that were in some particular studies. Next part of this slide talks about the modifiable risk factors associated with diabetes, and there are 3 of them. One of them, which we just talked about in the previous slide, obesity and body fat distribution. If you change your BMI to less than 30, that your chances of developing diabetes is decreased. And then there's also physical activity. If you increase your physical activity, that also decreases your chances of developing diabetes. And then one very nice bullet point here at the end, you're going to do all this hard work. If you lose 2.2 pounds of weight, your risk of developing diabetes decreases by 13%. So just losing 2 pounds, you've already improved your ability to not get diabetes. Okay, so the next slide there, we're talking about what are the types of programs with effective outcomes. And the bulk of this, rest of this presentation is basically going to be on these items here, which are food intake and physical activity. I'm going to forward to the next slide because I want to talk a little bit about food intake. Why is it so important that we are tracking what we're eating? It's important because you want to make sure that the calories you're taking in are something that are safe and appropriate for your weight. So if we're going to be doing lifestyle changes, we have to kind of know, okay, what is our baseline? Where are we starting? So it's recommended that you track your food every day, everything you eat and drink every day. And you can use paper journals. You can use apps that are downloadable on electronic devices. But it's really important to keep track of what you're eating and what you're drinking. 3 musts. Be honest about it, be accurate, and be complete, because you won't be able to make changes if you don't recognize that there might actually be a problem with the types of foods that you're taking in. Next slide, how to eat better. So we've done a great job so far of journaling what we're eating. Now, what does it matter whether I eat 3 cups of pasta versus 3 cups of vegetables and all these other delicious things that you're going to be putting on your plate? How do you eat better? If it were easy, everyone would be doing it, and it certainly isn't. So this slide right here, I'm giving you just a couple of guidelines of some resources that you can reference to see what are some good foods for me to eat. ChooseMyPlate.gov. That is a website that a lot of the literature references, and what they do there is they list all the food groups: breads, vegetables, fruits, milk, yogurt, meat, poultry, fats, and sweets. And in this day and age, it gets very confusing because some of us have grown up with the food pyramid where it was quote unquote okay to eat a lot of carbs, and then we come into no, you should be eating all fat, and then oh no, you should be eating all protein. So it gets very confusing. I think that what they give you on ChooseMyPlate.gov is everything in moderation, which the literature says is really the best way to lose weight. Portion size, very important. Some people, they really go gung-ho, which is great. They have measuring spoons and cups, and there are programs out there that encourage that, which is absolutely fine. For everyday person like you and me, that might not always be feasible. So what I kind of would like to share with you is there are everyday things that you can compare to see what you're eating in terms of portion. 1 cup could be equivalent to a baseball. A half a cup could be equivalent to a light bulb. If you're going to eat chicken or meat, the recommended daily allowance of 3 ounces would be about the size of a deck of cards. And an ounce of lunch meat would be something like a compact disc, like a CD. So these are just things, to keep in the back of your head so you can compare what you're actually eating with what you think you're eating. And then the last few bullets there on this slide on how to eat better. Eat smaller servings of your usual foods. Instead of eating a baseball size worth of ice cream, maybe you'll eat a light bulb size worth. You want to eat salad and at least 1 vegetable at dinner time. What you can do is you have your plate. You can make half of it vegetables. You can make a quarter of it a starch, and you can make a quarter of it a protein, and try to make that a habit every day for every meal. Share your course when eating out, or take home half. My dad loves to brag. Every time we go out, he'll tell the waiter or the server right away, I'm only going to eat half. And really, this is something that you can do. He asks for half of a portion, and the other one is boxed away, so it's not even on the table for him to eat. Because we all know that nowadays, all of the servings are big platters full of food. So 1 serving at a dinner at a restaurant could really be possibly 2 meals. So take half home or share with somebody, and then reconsider your cooking methods. Roast, broil, grill, steam, or bake versus deep frying. The next slide here is about reading food labels. This kind of speaks to portions as well. What's hard is when you go out to eat or you go to friends' houses and you can't really control what you're eating. That's the tough part. What you can control, though, is what you bring into the house, what you fill your refrigerator and pantry with. So it's really important. I encourage you to get familiar with food labels or nutrition labels, because what you think is a serving might actually be 4 servings, which means that you're now having 4 times the amount of calories and 4 times the amount of fat. So really take into account what is the serving size of the items you have. There are all kinds of resources online where they teach you how to read food labels and all of those things, but that's just something to keep in mind too when you're considering what you're eating. And then the last part of our presentation here, we've talked about the food intake. Now we're going to talk about, okay, what am I going to do to increase my activity level? Because really the bottom line for improving your risk of developing diabetes is to get your weight in control. So we want to make sure that you develop activity into your, and what I mean by activity, it's good if you park your car 10 parking spaces away from the entrance of your job. That's absolutely great. But what we really want to encourage is really incorporating moderate intensity activity. And in 2008, the physical activity guidelines for Americans was put out by the CDC. And the recommendation for adults was 2.5 hours or 150 minutes of moderate intensity aerobic exercise every day. So if you think about it, if you want to do 150 minutes a week, that's 5 days a week, 30 minutes a day. And in addition to that, they also recommend that you do some 2 days of muscle strength training. So it's really important to do some moderate intensity activity as many days during the week as you can. For children and adolescents, the recommendation was to do at least 60 minutes or more of physical activity every day. Now, we are all busy and we can all think of reasons why we can't get these minutes in. And one of the things that the literature does recommend is to incorporate more walking for 30 minutes most days of the week. And why walking? Because you don't need equipment. You can really do it anywhere. You can do it when you travel. So now you're going to say to me, Cindy, you know what? I think that's a great idea. I cannot find 30 minutes in my day to get walking in. So it's actually okay to take several shorter walks during the day, during the week. What does that mean? You drop the kids off and you go to work, you have a lunch break. Get up and move for 15 minutes. Walk around. If you have a 30-minute lunch break, walk around for 15 minutes if you can. And then later in the day, maybe you only have another 10 minutes. I think that short bursts of activity during the day is better than no minutes at all. And it's really going according to what the recommendation of the CDC is. Important to find something you enjoy that keeps you moving, because if you don't like to cycle, you won't cycle. Try to find something you like to do. Find a buddy. Encourage people to try new things with you. I see this all the time. As Linda mentioned, I teach some group fitness classes. I have a couple of people who initially told me I am not doing anything but running. And sure enough, now they're asking me how they become certified for these classes I teach. You just never know until you try something new. And as we mentioned before, you're keeping a log of your food. I think it's a very good idea too, as this last bullet point suggests here, to keep an activity log of how many minutes you're spent performing a certain activity. Very important to give yourself credit. Okay, and then to kind of tie everything up here, you're looking at, all right, I'm exercising, I'm doing my activity, I'm eating well. How does this all contribute to preventing diabetes? Well, this last slide here says calories out greater than calories in. Weight loss is a matter of energy or calorie balance. Your weight is a result of the balance between the food that you take in, which is calories in, and activity, calories out. I have a graph here that you might not be able to see, but you can reference later. It talks about fat, carbohydrates, protein, and alcohol. And each one of these items, each gram of these, carries a certain amount of calories in them. So for 1 gram of fat, that's equivalent to 9 calories. For carbohydrates and protein, it's 4 calories. And for alcohol, it's 7. So as I had mentioned before, some of the programs that really look at controlling the fat grams you consume are sometimes the most successful in losing weight, because you get the most bang for your buck if you're tracking your fat grams, because they carry the most amount of calories. So what we want to do is make sure that our activity level is greater than the amount of calories that we're taking in. I have down here that a rule of thumb, 1 mile of brisk walking, about 15 to 20 minutes, is equal to about 100 calories. So some interesting, again, you can do internet searches on all of these things, but things like standing, believe it or not, like if everyone stands up right now and stands for the next 20 minutes, you'll be burning between 24 and 40 calories for that 20 minutes. So maybe you'll take the rest of your lunch standing and you'll be burning calories while you're eating. There's also, believe it or not, writing you burn calories. And the obvious ones, like the physical activity ones we do. But even our activities of daily living, we're burning calories as we're going about doing our day. One thing here I do want to mention is, how do we lose weight if we know what the calorie deficit is? 1 pound of body fat, now this is something to think about. 1 pound of body fat is equal to about 3,500 calories. So if you want to lose a pound a week, you're looking at getting rid of that 3,500 calories. So how do you do that? Well, you can look at your food journal and say, well, I had 500 calories worth of takeout food every day. So guess what? If you take that out of your week for the following week, you'll probably lose a pound just by taking out that extra 500 calories a day. Another thing you can do if you want a caloric deficit of 3,500 calories, you can increase your activity level. I told you that walking for 20 minutes burns about 500 calories. If you walk instead of 1 mile, try to do maybe 3 or 4 on weekends, do a little bit more. That will also improve your calorie output. So just some things to think about, why it's so important to measure calories in and calories out. Now, to the very last slide here is what happens if, okay, I've done all of these things, and as I told you, these are not 100% guaranteed. If you follow all of these tips, you're not going to develop diabetes. there's a chance you'll go back to your doctor next year and you'll get another A1C, another blood test, and you find that your blood levels are in the diabetes range. It's not the end of the world. In fact, it's very important to continue to follow up with your physician and make sure that you're taking care of those complications that I had talked about that can develop with diabetes. There are support groups available. You want to make sure you're comfortable with your blood glucose monitoring. And of course, if you need to have follow-up with specialists like your eye doctor for eye exams, make sure you talk with your podiatrist for your foot care. You might have to see a kidney specialist or a cardiovascular person for heart function. If you have diabetes, it's okay. It is not the end of the world. You just have to make sure you take care of yourself. And that is all that I have for today.
Thank you, Cindy. I have just a couple questions, and I'm thinking that possibly our listening audience may want to relate to some of these. I was following along with your chart, and I do score above the number 9. I'm like everybody else. How long, if I follow a lot of your recommendations and making these modifications, can I anticipate seeing some change in my sugar screenings?
Very good question, Linda. So I know everything, a lot of things in life are immediate satisfaction, or when is this going to happen? When can I do this? This kind of goes back to what I mentioned about program planning. If you set weekly goals for yourself and you make sure that you are monitoring your weight and what you're eating and your exercise, by the time you go back to your doctor, it really depends on what your physician says. If he or she wants you back within, let's say, 3 months for a follow-up, and you see some very good results in terms of your health, then it's very likely you could see changes in your blood glucose levels after 3 months. If on the flip side of that, if the accountability isn't really quite there and your weight hasn't really changed and you're continuing with certain habits, then if you go back in 3 months and you haven't made those lifestyle changes, then most likely it's not going to change. Your sugars won't change. So it really depends on how much effort and follow through and accountability you put into it.
I can do it. 3 months. It's obtainable. All right, there's one more question, if you don't mind.
Sure.
At times when I eat, I honestly can say that I feel sick from it. If I eat a lot of sugar, if I'm at a holiday party and I've had a glass of wine and I have had the dessert, I can feel sick after all of that. So I don't know if that's my internal thing saying, yes, Linda, you're pre-diabetes, or if it's just something I'm thinking. How often should I, this is a two-part, how often should I see my doctor to have my levels checked? It's sounding like 3 months could be it. And are there any kits I can buy in the Rite Aid or a pharmacy that I can do for my own home test before going to a doctor?
So I'll answer the second part of that question first. In terms of home kits or do-it-yourself types of things, certainly you can buy them and they'll give you a number, but what you want to do is how are you going to interpret that number? What does it mean? So the follow-up with your doctor is critical for that. We can all go and as I said, we can prick our finger and get a number and then it'll come up, but we don't know, maybe a certain number is normal for you, maybe a higher number might be okay. So it's always, I would always recommend to see your physician first. And then because prediabetes doesn't really have any symptoms, as I had said, it's not like you're thirsty, you're frequently going to the bathroom. There's really no way to know whether you're pre-diabetic. So it's really a matter of checking in with your doctor, having those blood tests drawn to really know whether you fit into that category or not.
Okay. All right. Thank you very much.
Yeah, you're welcome.
Thank you very much,
I appreciate it. Thank you, Cindy.
Sure.
And I'm going to tell our listening audience that I do encourage you to share this webinar with your friends. All of our speaker series events become an active archive presentation on our website. You can pop in at any time to see all that it has to offer. Keep an eye out for our 2016 series that will be coming soon. I'm going to close by thanking Cindy for her time today with her insight, education, and valuable information. Your presentation has helped me, and hopefully many of our listening audience as well. Here is to better health for all in 2016. All of us at Personal Wealth Strategies extend our wish to all for a blessed holiday season. Thank you very much.
Thank you.